Hello, everyone, and welcome to the professional webinar. Today I'm very excited, and I hope you are too, because we have a pediatric spinal cord injury specialist, but he's really more of a rehabilitation specialist, spinal cord being his specialty area, but lots of pediatric information. Dr. Lawrence Vogel is recently the medical director of the Chicago Shriners Children's Hospital, and he is now a certified life care planner. He's written numerous articles in the pediatric rehabilitation area, and he's a co-editor of a textbook, SCI, in the child and young adult. And so with that, I'd like to welcome you today, Dr. Vogel. It's nice to have you here.
Good afternoon.
First of all, would you like to tell us a little bit about what sparked your interest into getting into pediatrics and especially in the area with children?
Sure. Well, I'll be frank. Somewhere in medical school, my third year, I wanted to become an internist. And then I decided, you know something, I love my grandmother, but I did not want to take care of her, which would be me now. And I realized I really love children and adolescents and like taking care of them, and got a passion for it in the summer between my third and fourth year of medical school. And it just like a switch, turned the switch, and I became a pediatrician. So I've enjoyed, did my internship and residency in pediatrics, and then did a fellowship in pediatrics. Infectious diseases actually was my entryway into stuff. And taking care of children is great. I mean, to watch people develop and grow, and hopefully you're helping them, move on to adulthood and in a successful life. And so that's how I got involved in pediatrics, and I'm happy I did it.
Well, I'm so glad. We'll take just a moment here now that you've introduced yourself, and we'll just describe ourselves for the audience. So I'm Nurse Linda. I'm a middle-aged, and I'm holding on to that for a few more years, middle-aged female with brown hair, and I wear glasses. I have a pink top on today and a white background. And would you like to describe yourself, Dr. Vogel?
Sure. I wish I could say I was middle-aged, but I'm a little beyond that. I feel like I'm a teenager most of the time. And some people say I act that way. I have gray hair. I wish it was blonde. I have black glasses on. I have a white shirt and a navy blue or bluish jacket on. And I guess I'm a white male. I guess I'm a he and his, right? I'm trying to learn, trying to get back into the 2024s, but yes, that's me.
Okay. And again, it's so nice to have you here and your interest in pediatric rehabilitation. And so let's start with the first question here. And that is, what do you think are the major challenges for children with paralysis? And what can be done to help that situation?
Oh, that's quite a big question there. I guess we could spend a couple hours. Well, I think the biggest challenge is, to kind of look forward to where you got to go. Of course, you got to, work with where you are. And I think the challenge for the child, and I'm going to say kid, meaning a child or an adolescent or an infant. So everybody's a kid in my book. The challenge is for the child and the kid, as well as his family, to be able to kind of deal with the fact that they sustained a spinal cord injury, whether it be traumatic or non-traumatic spinal cord injury damage. And so the challenge is to get back and do what you're supposed to do. So I'll cut to the chase. I think that kids have to be kids, and I think it's very, very important. And whether or not you have a spinal cord injury or any issue, the child has to be treated as a child and expected to be a child, for the good and bad. So as I always say, they got to have chores. And most importantly, we have to have expectations that the child is going to move on and move on in a direction as much as they would have if they didn't have a spinal cord injury. So again, I have to emphasize that an individual with a spinal cord injury is a child first, and then secondly, is a child with a spinal cord injury. And so it's very important that the child understands that, the family understands that the community understands that, and as healthcare providers, we understand that. So, I mean, there's a lot of, as you can imagine, there's a lot of challenges in being able to go back to what they were doing before. And of course, it's interesting when you think about a child versus an adult. You know, a child who's injured at 2 years of age is very different than a child, an adolescent, 16 years of age who's injured. You know, they're what they've done before, what their expectations are. So a 16-year-old has a lot of a fair amount of history and knows kind of where they were going to some degree, whereas a 2-year-old has their whole life in front of them. But the challenge is to go on and develop as any child does, and in each developmental stage, be able to be successful in that. And as a care provider, I hopefully help them, deal with the step where they are today and what's going to happen tomorrow. Because it's really important to understand, pediatrics loves the term anticipatory guidance, to help people understand what's ahead of them. So it's not a surprise. So a good example would be, a 10-year-old with a spinal cord injury. You need to be sure that they and the family knows they're going to go through pubertal changes, just like they would have if they didn't have a spinal cord injury. So you don't want surprises, and you want preparation. So I think that's another part. But I'm sure there's a million challenges, and maybe I can maybe if there's any more specific things than that, that's my first thought about the challenges and how to deal with them.
Well, I liked your point that you brought up about the developmental issues. And so how do you deal with developmental milestones, such as being able to sit up, but the child maybe doesn't have the mobility to sit up, so they're not going to meet that particular milestone. So how do you adapt to different things like feeding yourself if the child can't use their hands, or walking? How do you adapt those milestones?
That's a good question. I'm going to just stick first with the kind of moving, because it's interesting when you think of we certainly see individuals that are injured at birth, they have spinal cord injuries beginning at birth, or somebody, let's say, with spina bifida too. But and so how do they get around? I mean, as you can well imagine, once you get born, after a while you start turning, you start sitting, you start standing, you start crawling. And mobility is very important for kids, for all of us. And so that's one critical thing, is to be able to get them to be upright in whichever way they can be, sitting upright, standing upright, whether you use a stander, braces, whatever it may be. But mobility is very, very important. So one of the things one of our therapists years ago said, that kids even at 9 months of age, they kind of, start moving around, falling, and then eventually start walking. So why are they not in a power wheelchair, for instance? Now, I remember in our hospital, had a Shriners Hospital, had a big mall kind of thing, look like a big basketball court, basically. And so these 12, 14, 15-month-old kids are in a power chair. And the question is, oh my goodness, what's going to happen? But something, that's what kids do. They move and they learn, of course, when they hit the wall, they hopefully don't do it too often. But so it's so that's, you have to, each development, you need to get them to move on to that. So, I mean, that's at least one example. As far as eating and feeding, again, it's interesting because, again, you could take the example of a 6-month-old who sustains a spinal cord injury, never really had to, other than the hold a bottle, never had to do anything. But again, that's what therapy, the team is to help them do what they should have done or would do otherwise. And whatever they can do to help them, I think is very, very important. To be able to feed oneself is very important. But the other thing, interestingly, is all of us need to be expedient. We need to get where we need to go. So sometimes it may be easier to have somebody, if you really have no use of your upper extremities, to have somebody feed you, but that you help direct that. In fact, I'll give a shout out to my old psychologist, Carolyn Anderson, who said, what's really important is if you can't do something, that the person with a spinal cord injury can explain to somebody else what they need. And so they direct their care and help direct it and modify it however they will. So we have to make sure that the kids, whatever their abilities are, that they can, whatever they can't do for themselves, they can certainly direct others to do it appropriately. So.
So those are important ideas, and normalcy is really important, it sounds like. What about if we look at from the point of view from the parent, and what kind of challenges are parents faced with as far as like getting health care for their child, or maneuvering through the school system, or just all kinds of issues with how does a parent best help their child?
Good luck, that's for sure. And they, they need to find they need to find people to help them. Like all of us need help throughout our lives. And a parent with a child with a spinal cord injury is no exception to that. So they really need help to understand how to navigate the system, as it were. And like, for instance, the school is a good example, is how to, one thing I would like, when I would try to get the kids to be in school the next day after discharge if possible, any way possible, because it's like so important to be able to go back to participating. I use the term participating in whatever your occupation is. As a kid, it could be play, it could be school. For people more than middle-aged like me, it's got to be work, maybe. But you need to get them into doing what they would otherwise do, and help the parents understand that and navigate it. It's not easy. I always laugh that I think insurance companies, if you had a 1-year-old with a spinal cord injury, would fit you with a wheelchair, one wheelchair that would fit them from 1 year of age to 80 years of age. So the family needs to be able to learn how to, obviously, to advocate for themselves, and they need help. But they need to learn how to do it within reason themselves. I think navigating is extremely important. I think I use the term expectations a lot. Maybe I've already said that 12 times, but I think it's important that you help patients as well as the parents establish expectations of what the child should do and what they need to do. And the expectations are, again, very important, because without expectations, we go nowhere. Expectations should be reasonably high. It shouldn't be too high that nobody could ever receive them. But again, you can't say, well, my poor child has a spinal cord injury, so I'm not going to push them. I mean, well, you shouldn't push kids anyway, but you should have expectations that they're going to do what makes them happy and successful and occupy their time in a good way.
And so as a parent, how would you learn how to do that? Some people are natural negotiators and they're just very good at it. And then there are others of us that are kind of a little more shy and retiring and not really aggressive to push forward. So if you were a parent and you needed to learn how to advocate for your child, where would you go to learn how to do that? Would you go to a child psychologist or family therapist, or would you rely on your physician, or how would you learn to do that? Would you watch people doing it, or how would you learn that?
Yeah, I wish I could say the physician would be the person I'd come to, but I'll tell you who I would go to. I've been very fortunate in my life, in my professional life and personal life too, but working with a team of people, including therapists, PTs, OTs, speech, social workers, psychologists, dietitians, rec therapists, child life people. I'm sure I'm missing, and nurses, of course. And so all of those people are the ones that help. And parents sometimes find one staff member more helpful, just for whatever reason, to help them, guide them in that circumstance. So the professional team, so obviously trying to connect up with a good spinal cord injury or rehab center that specializes in children and ideally in spinal cord injuries. The second part, of course, is peer, talking to other parents. We used to, we had a couple projects years ago. Erin Kelly was a PhD psychologist that worked with, and we had these family programs, and that was really helpful because, again, it helps to talk to other families, sometimes for the good and bad, but in general, it's for the good. So it's the parents need their peer counselors too, as it were. So I think that's very helpful. So I think it depends on the person, but I would certainly go to at least professionally to a rehab team that has expertise in taking care of obviously kids and particularly kids with spinal cord injuries. Hope I answered that question reasonable.
I think you did, and I think it's really important that you mentioned other parents as well, and that's important. But I also think it's important they might have a solution that worked for their child, but then you have to analyze that solution and see, well, maybe that's the right or not the right thing for your child. So it's so very individual, and I think when you have that team, you get a lot of different opinions about what might be possible solutions that you can kind of put it together a bit.
Well, I think that's a good point. I think that it's like everything else. I can give advice. I give lots of it to my patients and friends. But what's important is that people have to process that advice and suggestions and what they see and decide what fits best for them and the child and their family. And they have to be the final arbitrators of what needs to be done. And I mean, they don't need to feel bad that they didn't take my advice. Because a lot of times not taking my advice may not have been the best thing to do, but they have to decide what's best for them and their family, and what fits best. I mean, that's probably the most important thing.
We have a question that has come in, and the question is, what are some of the causes of spinal cord injuries in kids?
Sure. So, it's interesting. So probably the most common is still motor vehicle crashes, unfortunately. And we're talking about, I take care of people till 21, 22, but certainly in people under 21, motor vehicle crashes are still the most common. Unfortunately, probably the second or third is gunshot or violence, which is unfortunate. But motor vehicle crashes. The other reason why I say this, so I always say spinal cord injury is like a traumatic injuries, motor vehicle crash. You get hit by a car or a bike incident, or gunshot wound, but we see so much more of non-traumatic spinal cord injury. So it could be, things like certain kind of malformations of arteries and veins, or it could be acute flaccid myelitis, which is something which is similar to polio, for instance. Or you can have birth things like spina bifida, which, so we try to say spinal cord disorders, spinal cord injuries, which are traumatic, and then you have non-traumatic spinal cord injuries, which probably, I'm not sure what the most common cause of non-traumatic spinal cord injuries are, but I'd have to think about that. But I do know the traumatic, certainly motor vehicle crashes are the most important.
And we certainly have had a new cause of, well, a cause of spinal cord injury has come with COVID. Now, that paralysis that has come with COVID has been around for a while, but it's certainly been exacerbated through the COVID epidemic. Do you see a lot of people with injury from secondary to COVID?
I have not, but that may be just my limited experience. But no, I've not seen that. What we saw more of was something called acute flaccid myelitis, which they think is due to a virus, an adenovirus, but it's still, they're still trying to figure it out. But it's kind of like polio. In fact, one of the people that is expert at that is Dr. Christina Sadowski, and she's quite an expert at that. But so that is probably the thing that has about the last 8-10 years. It's periodically comes up, particularly in the summertime. So that's probably the thing I think about most.
Okay. And also plug for our own organization. There is a webinar with Dr. Sadowski. If you look on the YouTube channel, if you're interested in more of that information, you'll find that there on the YouTube channel. Now I'm going to switch gears a little bit because there's something that's very important, and it's especially important to parents and individuals in the pediatric community, and that is life care planning. And I don't think a lot of people know about that process. And you are now a life care planning expert. So can you tell us about that process? Who would qualify for that? What goes on in that whole process?
Sure. So so I guess when I was getting closer to think about retirement, I thought, well, maybe I could keep myself busy. After being on call basically 24/7 every day of the year, I decided eventually about 5-6 years ago, I need to retire from full-time practice. So I decided to become a life care planner. So it's typically almost most of the time it's related to some kind of a litigation, frankly. So what a life care plan does, and spinal cord injury is a good example, is to be able to identify what an individual's needs are, and to be able to project out what those needs are into the future. So, for instance, medical care, physicians, psychologists, what kind of potential surgeries or other invasive procedures, diagnostic studies, therapies, both evaluations as well as treatments, architectural changes, transportation, education, and if they need nursing care, and of course, equipment and supplies, medications. So you identify, there's probably about at least 15, 16 different buckets of needs as you can look at it to try to identify what those individuals' needs are. So, if they're on an intermittent cath program, what is needed to be able to perform intermittent cath. And not only just now, because again, if it's a child, what your needs are at 3 years of age are definitely going to be different than when you're 18, and different when you're 75. So we try to the life care plan tries to project out what those individuals' needs are and how to meet those needs related to the medical condition, in this case, spinal cord injury. I hope does that make sense?
So, who would qualify to go through the life care planning process?
So
You said what people with litigation, but can you do it if like there's birth trauma, or if there's some accident? That sounds like litigation kind of thing. And when can you do it? So there's some people that don't know about life care planning, and maybe something happened at birth and now their child's 12. Could they still take part in that process?
sure. I mean, it doesn't have to be litigation. It's just that's the most common, I guess, entryway to it. So I've done some life care plans for my patients that are not litigation specific. But actually, in a way, that's what I do as a clinician to help people understand what are their needs. It's just a life care plan. You prepare tables that say, well, here's what you need now till 18 years of age, and then when you're a young adult and a middle-aged adult and an older adult. So you could do it. It's just a matter, it's unfortunately, it can become somewhat expensive depending on how extensive you want the life care plan to be.
And then, if the life care plan is approved, and I'm sure that there's probably some back and forth discussion about those, if it's approved or how it's approved or what's approved. And so after that process, then what happens? Do the people automatically get that equipment? Do they get a new house, or how does all that work? Is money paid out yearly or over in a lump sum? How does all that work?
Well, I'm sure it's all different ways, just like you basically described it. Typically, the court would, in case of litigation, the court would decide how it works. So typically, it would go into some kind of a trust fund and have someone who, it could be a parent, or it could be, depending on the circumstance, a professional trustee that then can identify how to distribute the money now and then in the future. I suppose it could be lump sum. My guess is that's less likely, but I don't actually know that. Usually, I think an economist comes in and says, "Here you are, you're 20, and this is how the money needs to be spread out." So it's invested, and it's distributed on a as needed basis or on a periodic basis after the settlement occurs.
And then would a child still qualify for Medicaid, or is it just all based on the life care plan?
It depends on the life care plan, depends on the state too. Um,
Ah,
it depends on your settlement too. Of course, I think if the settlement included healthcare, for instance, let's take, for example, it paid for physician visits, psychology visits, therapy visits. I don't think the state that you're in would be happy if you're double dipping and getting either state funds or a Medicare, Medicaid, or private insurance. So I don't. So there has to be a kind of a division between those two.
And my understanding has been that you could go through this process until the child is 21. Is that true, or is that just something that people just say?
Yeah, I think it varies on state, what state by state. And of course, it depends on, this, and frankly, I don't know the law so well, so, statute of limitations kind of stuff. But, so the life care plan itself, once you develop it, it should, project things over their entire lifespan. But a lot depends upon the state by state, kind of legal stuff.
Okay, and we have a question about the life care plan. And the question is, does the planning have to be paid by the patient, or is it an entitlement / right given to everyone with a physical disability, as in the Disabilities Act?
It would and again, I have very limited experience with life care plans outside of the litigation field, so I really don't know. I don't think I'm not. I don't think that I can't imagine that that life care plan would be funded by a state, as it were, any kind of governmental body. But I could be wrong. I don't know.
Well, I'm with you. I have never heard of it that way. It's usually anyone that I've ever seen. I have not seen, probably as many as you have seen, but the ones that I have seen, that's always initiated by the patient or the patient's family, and they have to pay for that, and then then it goes to court, and it's all decided how that's all going to work out. So it's not a right. It's not given to everyone. But it can also be adults can do it if, like you say, if they had a traumatic accident, or like you say, if there was some kind of litigation, adults can do the process as well. But it's always the patient that initiates it. I've never seen it go any other way.
Yeah, so I mean, all what I see is just simply someone is started some kind of a suit, a lawsuit, and then the attorney would hire the life care planner. I mean, I've occasionally been approached by individuals, but very rarely to prepare a life care plan independent of a lawyer doing that.
So it's a huge process, and one that should be not taken lightly, because it's quite a process. But if you qualify for that, then it would be a good resource. But I just don't think a lot of people are aware that that even goes on. Let's move on a little bit down the list here, and let's talk about how the healthcare provider can or how paralysis can be treated for mental wellness for children, teenagers, and the adult parents that are taking care of them. Can you talk about issues and circumstances? Paralysis is changing. I know that kids grow up, and you get your routine going and you think you've got it all figured out, and then something happens, like all the other kids are in ballet class, or all the other kids are in baseball, and you kind of like, oh, well, that's not going to be us, and so there's kind of this chronic sorrow that goes on with as these different milestones are reached. So can you talk about how to maintain a child's mental well-being, and what strategies parents can use to maintain their mental health?
Well, I think you just said it all yourself there. Yeah,
No.
it is a challenge, and that's kind of what I was talking about, anticipatory guidance to help. And it's so the way I see taking care of people is I'm not just taking care of the child, I'm taking the family. In fact, the truth is, the medical home is that the patient is a center, they're surrounded by the family, and then the community healthcare providers, and then I come in kind of outside of that. So it's really important that everything originates. The key players are the patient and the family. For sure, I can't be. I'm not the key player. They are the key player. But it's important because I always notice that, like, kids with disabilities, whether it be a spinal cord injury or CP, are are moderately well accepted, like in preschool and kindergarten, first grade, and all of a sudden in second grade, third grade, things change quite a bit. And so parents and patients need to be prepared for that. And of course, hopefully people that surround them, teachers and staff, help prepare them for that. So that, both the patients themselves, but also the people surrounding them understand that. But it is, I think it's a challenge. But what you always have to do is say that your expectations is that the kids will participate as fully as they can and find a way to make meaningfulness out of their lives. But you're right, it's easier said than done. But so for instance, we have a lot of rec therapy. I find is very important. How do we get these kids to do what they do? I mean, when you think back 40, 50 years ago, there were wheelchair sports, but now it's like, you even see commercials with people doing, people with disabilities participating. And I think should be our expectations, is to try to figure out how can that child go throughout their life at different stages and be able to participate at the highest level possible that they can. And sometimes it's going to be even at a higher level than their peers, but always their expectation is that they're going to do what they feel is most important at that specific age.
Great. I recently met a couple, and you could just see in their body language, on their faces, they were just exhausted. And they had a child who was turning 6 and had spinal cord injury, had a lot of issues going on, and she was now at a size where it was difficult. They couldn't pick her up and just move her, so it was more difficult. They couldn't find anybody that would stay. They could find sitters for their other children, but they couldn't find a sitter because this child had medical needs and had issues where a regular, like the neighborhood teenager couldn't come over and babysit her. Are there any resources where people can get respite care, where they could even just go out for evening? What are your suggestions on how they find help, just to give them, just even an evening off?
Well, I think you make a good point. I think respite care and being able to, as a parent, you love your children, but you also need some time alone. So I think it's important to be able to have that kind of services, respite care, whether it be for a couple hours at night or a long weekend. That's critical. Again, at least from my perspective, you at least start, for instance, with your healthcare team to see what resources they have. And of course, it's got to be community based, because if I'm in Chicago and they're in, Oklahoma City, that makes it difficult. But, part of my job and our team's job is to try to connect them up with people locally who can help them in those type of things, because that is what you're saying is very important, because, you can't ask your teenage neighbor to come over and catheterize the 8-year-old boy, for instance. So you need to be able to find the resources for that. And typically they have to be local. That's a challenge, quite a challenge, I think, for families. And I think as a healthcare provider, that's part of our job, is to try to help connect them up with local community resources. So, I mean, even things like United Spinal Association or whatever local resources you have, you need to utilize and find out what works for you.
And so I think I'm hearing a theme from you here, Dr. Vogel, is that your healthcare provider is never off duty or never out of touch. You never outgrow your healthcare provider. Always keep them handy, right? So they're always there ready to help.
Well, it's funny you say that. I always say, as a pediatrician, one of the good things about being a pediatrician, once they hit 21, you say goodbye. It's kind of like your own children. When they hit 21 or 18, you say goodbye, but they keep coming back anyway. So anyway,
Yeah.
my former patients keep calling me or asking me things. So I realize I need to do a good job so that they don't have to ask me too many questions too often. But that's what we're all about. It's not like it ends when you're 21. Life continues, and so that's a good point.
That's quite a compliment to your career that you have people that won't let go of you because they trust and like you and you give good information. So, you're very helpful in that regard. We do have a question about how often are adaptive sports suggested to kids who will not be playing team sports in school? Example, therapeutic and adaptive writing.
Well, I think, as I say, I think rec therapy is just critical. We're again, as Shriners, we've been very fortunate. We have 2 to 3 rec therapists at any one time to be able to find out, first of all, what's most important. What is the child interested in? Not what I'm interested in them doing. I'm not gonna say, oh, I want you to do wheelchair basketball when they're interested in, I don't know, archery or riding horses. So obviously, equine therapy, hippotherapy, all those things are very beneficial. So again, I mean, it doesn't have to be the rec therapist because the team can think about this, and the rec therapists don't work in a silo either. So they figure out with the team what with the family and patient, obviously, what they want to do and what works best for them, what's available, both what's available and financially what's suitable. But I mean, I think the kids really need to figure out what they enjoy. The other thing, I always think recreation, actually it should be recreation and leisure time. What's really important in our lives is we occupy our time in a meaningful way, whether that be volunteer work, uh, you know, full-time employment, um, whatever it is, you've got to occupy your life with something. And recreation and leisure is another thing that's very important.
It sure is. So how can healthcare professionals who are listening today, how can they adapt some of these ideas into their practice?
Good idea. Read my book. No, I think,
Right?
well, I think, yeah, I don't know. I guess the way I see when I take care of people, I always think, what would it be like if I was on the other end? What would I want me to do to help them? And so, I think, of course, well, I should say that every 2, 3 years, we have a conference called the Steel Conference, which is coming up in December. I think it's in Arizona. I think it's in Phoenix. It could be Scottsdale, one of the places, but Arizona. And so it's a pediatric conference called the Steel Conference. So professionals, certainly that's one way. You can always call me and you can talk with us. But that helps to learn, and it's very interdisciplinary. So it's therapists, nurses, psychologists, social workers, all different variety of people. So to be able to really provide a comprehensive interdisciplinary team approach to caring for people.
And I think your previous comment about knowing what's available in the community is also very helpful for people because it's really hard to figure out the right words to look up whatever kind of place you're looking for help, a respite care. What do you Google to find that in your area? So if you have a resource in your healthcare team, perfect. That kind of helps you cut through some of all that legwork to get there.
Oh, for sure. No, you're absolutely right. I mean, and there are a lot of course, now with the internet, there's a lot of resources for people with disabilities. And the University of Alabama is the Lakeside. I hope Jim Rimmer is not listening to this. You'd shoot me if I say it wrong. But they have some great resource for identifying recreational facilities and opportunities nearby you, no matter where you are. And that's very important. Again, if I live in Chicago, I mean, it's very different than if you live in the middle of a very rural area. So you need to be able to you can't just, one shoe doesn't fit everyone. You got to special, be very individualized at your approach.
Right. Okay. Now we've got some questions that people pre-submitted. And so I'm going to shoot some of these out to you. So some of them are very broad, some of them are very specific, but here we go. What are the current equipment limitations that are faced in an independent mobility for pediatric? So what are some equipment limitations that you see that people face?
That's a difficult one. Equipment. Well, I always think about mobility devices, obviously, and wheelchairs being probably the most common one. And it's to be able to have a wheelchair that is, custom made for children or for the individual. That's my bad joke earlier is you can't find a wheelchair that fits a 8-pound baby to a 150-pound adult. So you need to find equipment and people that will help prescribe the right equipment and to evaluate whether it's appropriate. And also over time, make sure that it remains appropriate. And again, with development, you've got to make sure you change. I think that's probably the issue of mobility, I think is extremely important. If one can walk, of course, that makes it, that's one thing. But if someone depends upon wheeled mobility to some degree or to completely, then you need to make sure that you have appropriate equipment and that it's appropriate as the child grows older. So some of our kids, as you can well imagine, you go on to college and to a big campus, you may want some kind of you may be able to use a manual wheelchair generally, but you may want to use a power assist device. So that is important that people know what's available, what the alternatives are, and plus not just what's available and appropriate, but is it affordable too? But I guess that's at least one thought about equipment and availability.
Well, now, what about some of the newer things that are coming out, the functional electrical stimulations? Everybody's interested in that. Do you have any thoughts about that treatment in pediatrics? And finding that equipment is very difficult and getting it funded. Do you think it's worth the time and expense to pursue those things?
I would say it is, yes. I mean, I think that again, it's not, it doesn't not everyone would be appropriate, both because of whatever their physical condition is and what their desire is. But I think that functional electrical stimulation, probably the most common would be bicycling, either in both some upper extremity ergometry type of things too. So I think in the appropriate setting, that would be, I think that's very appropriate. Funding can be very, very, very difficult, but that's why we, the therapists know how to help write the right letters, and to try to push it, because I think that functional electrical stimulation is very important. Now, there's the other, you can go on to more modern, not modern, but a little more fancy stuff that like implantable electrodes. And of course, we think of was it Elon Musk and the kind of having a brain device interface stuff, which I think is another area that look forward in the future. But right now, mainly when I think of electrical stim, other than stimulating an individual muscle or muscle groups, I think of cycling, either upper extremity and lower extremity. So I think it's very helpful.
Okay. Somebody wrote in here, they said Move United has a great tool to find adaptive sports near you. So if you want to look on the computer for Move United, there's a great resource there. So thank you for that contribution. Here's a question for you. Can spinal cord injuries be reversed?
Yeah. Okay. Well,
It's a big one.
that's a good question. I always start with, if I had magic wand, of course, I would reverse all the spinal cord injuries in the world. But generally, it depends, of course, upon the injury. And we know that some individuals have injuries that don't change at all. Others who have significant recovery. And again, there's all the extremes. The vast majority of people don't have typically don't have, let's say, substantial increase in function. So, I think over the years, scientists and clinicians have tried different things. I mean, from using steroids, a variety of different measures, but we're still working on trying to minimize the damage once it's occurred. But the cure, I think it depends on how you look at the cure. I like the term cure and care. I don't think it's one or the other. It's a combination of both. And the first thing you do is you care, and care for whatever the issues are, and whatever things you can cure. We wish we could cure much more.
Isn't that so true? That is so true. Here's a question. You had spoken earlier about if you could, you would get kids out of the rehab hospital and into the school the next day or whatever, wherever their target is to go. So here's a question from someone. It says, our facility has an array of outcomes when it comes to our pediatric adolescent clients successfully returning to participating in school post-injury. Do you have any pearls of wisdom about ways to assist families in supporting their child's return?
Sure. Well, I think, we used to have and again, because I'm semi-retired, but before I retired, we had a very specific, I should find out if they're still doing it, but a very specific kind of a protocol, how to get kids back into school and how to get the school involved, how to get the family involved, whether it be, well, of course, nowadays we do Zoom, right? I mean, I have to laugh at this. I mean, when I think about pre-COVID, I guess it was Zoom pre-COVID, but since then, now we all Zoom everything. So it'd be much easier today than it was 10 years ago, I can promise you. So, sometimes if we could, we would have the patient, the child with a spinal cord injury, go visit the school, even just for half an hour, so they could go back to the classroom they were involved in. It may also require someone talking to the teacher in the classroom beforehand to explain what the issues are, what the differences will be, and what the similarities are. The kid is still the same kid. It just so happens to have a spinal cord injury. So I think that's kind of the way to go. I think it's good to have some introduction to it. Although sometimes I think it's like getting into jumping into, well, I don't want to jump in the lake. Don't dive into the lake. Sometimes you got to move and do it. But because if you wait, you keep just dipping your toe in the water, you never get in there. So I really try to encourage the kids to get back in as soon as possible. Again, there's always other issues that may limit them, but I think it's extremely, extremely important for them to get, as I say, get back in the saddle and ride.
Well, this brings up another thought, and I'm sure you've done many of these, the individual education plan. Can you talk a little bit about that and how parents can become involved in that with their child?
Well, sure. Well, there are legal requirements that the school provides accommodations for individuals. And so it could be an IEP, individualized education plan, or it could be for if somebody has less issues, it could be a 504 plan. So, but whatever it is, the school hopefully will do it on their own. Sometimes it requires that parents need to be advocates, and you can also get educational advocates. Sometimes you need somebody else to kind of help advocate and help the family or the child or both be able to make sure they advocate to the school, because sometimes, well, I hope there's not too many school superintendents on. I always laugh. I think that a school would say, it's the same thing like the wheelchair. They would take somebody in kindergarten and graduate them instantly, so they don't have to deal with them throughout the school. But I think most schools are very welcoming, and it certainly is much different than it was, I'm sure, 50 years ago or 20 years ago. But I think it's really important that you advocate and that the schools will do the right thing. And I think the vast majority of them will. But sometimes people need help. Some schools say, we've never had somebody who required a wheelchair. So, that's, you understand that. So they need help too.
Absolutely. The next question is, has massage therapy or other manual therapies played a role in your practice? And if so, what have your experience been?
So I have very limited experience in that. So I think that in this sense, if the patient, the person with spinal cord injury and the family feels there's benefits to it, in whether it be physical or psychological, then they should do it. As long as there's no harm done. So sometimes, I don't want somebody to be, somebody with a, cervical level injury who just underwent surgery. I don't want somebody to be, doing too many vigorous massages on somebody's neck. So I think, you have to be careful what you do.
So when they enter into a program like that, they have to be very secure in their anatomy before you start something like that. Here's a question for you about stem cells, and we were talking about this pre-show, but stem cells were all the rage. And so here's someone who writes in, how can I get my 17-year-old enrolled to be first in line for NervGen and stem cells? So do you just want to talk about stem cells and where it stands right now? Maybe start with that.
Sure. I probably, I'll be going to the American Spinal Injury Association meeting in, I guess it's 2 weeks from now, the 20th.
Yeah, it's coming right up.
Yeah, I think it's actually right during my wedding anniversary. So my wife's not going anyway, sorry. But anyway, so it's always good to find out what the state of the science is. I think that it's still, as we were talking about before, Nurse Linda, we've talked about this for many years, and it's I don't want to be pessimistic. I think we always have wanted and hoped for more, but at this point, I don't think there's any magic cure. And I think there's limits so far to what the studies have shown. I always say the internet's wonderful. Keep looking at it. But one thing is don't do something that burns a bridge that you can't cross. So for instance, we're talking about the shark cartilage, whatever it was, the rage 25 years ago, 20 years ago, you go to Mexico. If somebody does that, injects it into the spinal fluid, first of all, you could get complications, infection or other problems. Secondly, you may then lose the ability to be available for future studies and advances because of that. So I think that anything that's, I would never do something that is not bona fide, that reliable sources. And I think just, again, I would, search the internet, ask questions to those people, but know that if there is a significant advance, nobody's hiding it. I mean, you're going to see it on the channel, whatever news station you listen to, before, actually sometimes before we are in the medical field. So as far as that specific question, I would suggest to the person to contact that specific. I looked at that site. Contact them and see. One of the problems with kids is that studies typically don't include people under 18 years of age. And that is a problem because kids under 18 deserve, they should not, they almost call it an orphan kind of issue. So they need to be involved, included in clinical studies as time goes forward.
Absolutely. Absolutely. Now, we kind of hit on this next question a little bit earlier, but do you have any other information, and particularly in equine assisted movement and rehabilitation?
Not specifically. I mean, over the years, our patients have participated both locally at, at wherever their home may be, as well as while they're hospitalized, having equine therapy, hippotherapy, and a variety of things. I think, if it's available and patients feel there's benefit to it, it can help with spasticity, posture, spasticity, and psychologically. By the way, the psychological, emotional parts of all this is probably so critical in how we do in life.
Absolutely. So that we're coming up to the end of our time together. So for the last few minutes, would you please give us, this is our rapid fire, would you give us 3 take-home points that our listeners should should be involved with in what's really important, the three most important things in your practice?
Okay, well, I think number one would be a child needs to be a child and throughout. They need to do what a child or adolescent, whatever is appropriate at that age. Same with adults. Expectations. You need to establish expectations, both the patient and child, and the family and healthcare providers, the expectations of what one can do and never limit that. The last thing, oh my goodness, I had a good thought, but let me see. I had some notes here. Well, I think that's probably my 2 points would be probably the most important ones. Sorry.
Okay. Okay. Well, Dr. Vogel, it's been a wonderful time spending this hour with you, and I know it's been beneficial to our listeners. And I want to give you my personal thanks because I have followed you, as you know, for years and years and years. And so, because you've been in this for years and I've been in this for years. So I really appreciate having you on today and having our time to chat and for having all this important information provided to the community. Thank you so much for all the work that you do and for being on the program today.
Thank you for the organization. You guys do wonderful. Thank you.
Thank you.